Thank you, Devin. And have you ever woken up in the night with a pounding headache? And this could indicate an underlying health issue. And here to talk all about it is Nurse Christina Paris this morning. Thanks for joining me.
Hi, good morning. Glad to be here.
Yes, I'm happy you could make it in.
Yes.
The roads were manageable this morning.
Not bad. Not bad today.
Always glad to hear. But we're talking about migraines after you wake up. Is that right?
So we're talking about headaches. And there's different types of headaches.
Okay, so what is a headache?
Okay, so
start there.
Yeah, exactly. So a headache is when, so the brain itself doesn't get pain. What happens is irritation or something to our nerve endings or to the brain that causes the headache. So for example, if you have a sinus infection, you know, you get pressure here in the sinuses, it tends to push as your sinuses get inflamed, they get big, heats up. It starts to push up against the brain, which then triggers those nerve endings to kind of get hyperactive, and that will start the pain. So yeah, there's several different types too of headaches. So you can have primary headaches or secondary headaches. And so primary headaches are usually your cluster headaches or tension headaches, which typically are in the forehead. Then you've got your migraines. They're usually unilateral, which means that migraines will usually happen on one side of the head. And there's other ones, there's cluster, those can be around the eyes. Hormonal, they're due to hormonal changes. And then you have your secondary headaches. Now those are usually due to an underlying health condition or something else going on that's triggering the headaches. For example, hypertension, so high blood pressure. Your pressures could be pushing on those blood vessels, causing those blood vessels to push on the brain, you know, exciting the nerve endings, again, causing the headaches. Brain tumors, brain injuries, seizures, infections, dehydration, and sometimes people who are addicted to caffeine. Michael.
Hey, I haven't had coffee in like a week.
Oh, good for you.
So it's just, you know, anytime that the sore throat is, I usually stop drinking coffee for like a week or two.
Go to the tea.
Yeah.
Well, did you experience headaches?
It's tough to say because I was so congested. And as I had other problems going on.
Yeah.
But usually when I do stop drinking coffee for a bit, I try to stop every month or two.
Sure.
And then I do get like a headache for about a day.
Yeah.
But then the next day it's gone.
No, fair enough. Yeah.
But yes, so what would cause someone to have headaches while sleeping though? Because I feel like that's a time that I'd like to enjoy.
Right, so there are different things that can cause it. So one is sleep apnea. So just having insomnia or sleep apnea can cause people to have headaches. In fact, there's studies, not just sleep apnea, but just people who wake up with headaches in the morning. 1 in 13 people that have headaches wake with headaches. So sleep apnea is one of them. Hypoglycemia, so low blood sugars can kind of stimulate or irritate that as well. Sometimes just our sleeping position, you know, you have a pillow that's too high, kind of crinking the neck, maybe, you know, causing muscular irritation or inflammation that kind of goes up to the brain and gets it. Then there's tension and stress that can, of course, cause it.
Well, there you go.
Yeah,
that can happen.
So finding sinus headaches, as we had talked about before. Migraines, of course, you can get migraines at night as well. And then hypnic headaches. So, like the others, you know, with high blood pressure, then you want to treat the blood pressure. Sinus infections, you want to treat the sinus infection. Right. With hypnic, it's a little different. So it's different causes. Sometimes the insomnia can cause it, stress, different things can cause you to have, well, like I said, these headaches. But the treatments are different. So one thing they say is a shot of caffeine at night can sometimes relieve these hypnic headaches. Or there's other medications. There's a medication for gout that they use that can help, as well as lithium. So there's different things that you can try or do. But you know, of course, anytime that you're having headaches that are chronic, please go see your doctor, because there could be something underlying, and finding the underlying cause, you know,
of course,
it's definitely helpful.
Exactly. So some of these treatment options for this we've already gone through, but if the people are experiencing this, what are some general good things to keep in mind?
Sure. So, yeah, you want to, you know, get regular sleep. of course, that's helpful. Ensuring that you're eating healthy, don't skip meals, just some of the basic things. Taking part in relaxing activities such as yoga, or if you're into gardening or something like that. And then avoiding triggers, things that can trigger your migraine. And, just working with good posture. How many of us sit at the computer, and we're slumped shoulders and our heads tilted back, and we're trying to, we get in these just horrible positions. So maintaining good posture can help as well.
Well, there you go. Some good things to keep in mind as we head into the new year.
Yeah, and the big things, that you would want to kind of see your provider, of course, again, if you're having headaches, they're becoming more routine, you're not sure what's causing them, you don't have this history, you want to go and see your doctor. Of course, anytime you lose consciousness. So if the headache gets so bad, or people with migraines can sometimes have vertigo or feel off a little bit. If you're experiencing just severe pain you've never had, it could be an indicator of a stroke or something more serious.
Oh,
so
wow.
you definitely want to get in, talk to your doctor, and find out what's going on.
No, all great tips, and something to keep in mind as we are awake, and then as we are sleeping.
Yeah,
so,
right, exactly.
All right. Well, thanks for coming on in this morning. Always appreciate taking the time for Nursing the North.
Absolutely, glad to be here.
Well, we'll be right back with your daily dose of what's trending. Stay with us.